Good afternoon. I was thinking about how fortunate we are in nursing to have lessons of our interprofessional colleagues to follow. So you will see some common themes over the next 15 minutes. My only disclosure to you is that in addition to serving as Dean at the IHP, I also currently chair AACN's task force on APRN clinical education. And so while some of the ideas I'm going to talk about today are certainly informed by the work of the task force, I want to be sure, in the interest of adequately representing my colleagues, they're in no way intended to represent either the views of the task force as a whole, or certainly the perspective of AACN, as our work is still in progress. The task force was given, as you can see from this slide, a very specific charge by the AACN Board of Directors with 4 discrete elements. And it really is bullet 3 of this charge, which you see highlighted here, that places our work in the context of competency assessment. So when we think about the universe of core competencies in nursing that are amenable to study, I think that the examination of core competencies applicable to APRN practice as a test case, if you will, may actually serve to focus our attention on a more manageable segment of nursing practice, while also highlighting both conceptual and methodological issues that apply across all sectors of practice. There are, as you know, and as sound very similar from our colleagues, a number of convergent forces that have served to focus our attention and interest, both from a number of stakeholders, on the identification of empirically sound competencies, both individually and across all 4 APRN roles. And you see some of those highlighted on this slide. We certainly know that the not so secret is that our current methods of clinical education, which have served us very well in advanced practice over the last 40 to 50 years, are really seriously strained, and someone less optimistic than I might say broken. They're both as a result of growth in numbers, in complexity of practice. One of the things that I just want to highlight is that we hear from preceptors. The largest portion of clinical education in advanced practice nursing still is formed on the basis of a one-on-one apprenticeship-like model. And we hear from preceptors concerns that we heard as common to the physical therapy experience, that when a preceptor sees a student from one program at a certain level in their educational trajectory, that they look entirely different from a student from another program who is purported to be at the same level. Preceptors report confusion and burnout as a result of these continuously different experiences that they see. So certainly the identification of core competencies for advanced practice isn't a new discussion. It's about 30 years old. A few examples are highlighted on this slide. As you know, the core competencies for nurse midwifery were first published in 1978. They've undergone 6 revisions since that time, most recently in 2011. The widely disseminated non-domains and core competencies for nursing practice for NPs were first published in 1990. Their most recent revision was in 2011. And similarly, competencies for both clinical nurse specialists and CRNAs have been identified and revised multiple times. When you look at the current versions of these documents, however, you see some challenges to a research agenda that uses competency assessment as an antecedent to credentialing. The first is certainly there is limited conceptual clarity across these documents. There is not a single common definition of competency used across the 4 APRN roles. There's no common definition, and the competencies themselves really vary in both clarity and in scope, from lists, long lists in some instances, of psychomotor skills that are completely divorced from professional judgment, to complex cognitive skills, many of which would pose serious measurement challenges. Many of you have seen this figure from the LACE network in its description of the consensus model. And while this perspective would appear to suggest that there are common core competencies essential to all 4 APRN roles, and which some of us might suggest build on competencies in undergraduate nursing education, there has not been, to date, a coordinated or systematic approach to identify these competencies considered common to all APRN roles, or in any way a framework for standardized assessment. This rather inartful figure, I apologize, represents a very elementary model depicting themes arising from a think tank that was conducted about a year ago, inviting a variety of thought leaders who were asked to envision the future of APRN ClinEd. The figure is relevant to our discussion today, I think, because it highlights a few potential challenges relevant to a credentialing research agenda rooted in competency. The first is, as I've said, the need for clarity in the definition and a standardized approach to the ability to assess competency. The second question, which you see on the vertical axis, is the question of really who participates in the identification of competencies. And it's something that Jody alluded to earlier. The question is educators, practitioners, employers, consumers, which stakeholder groups belong in the individual and early identification of competencies. The third is really a need for a broadly understood, accessible, and efficient system of assessment. And while there may be no holy grail, as Eric said, of assessment tools, it does appear that there are, for us, significant lessons to learn from the work of our colleagues in physical therapy. We need an assessment system that extends beyond entry level, beyond education and entry to practice, and perhaps reflects the development of additional or advanced competencies through continuing professional development and continued practice. So what's the current state of competency assessment in advanced practice nursing? As you know, there are no finite set of nationally recognized, consensus-based, common core competencies for APRNs. There is an emerging, and I would say increasing in volume, discussion around the reliance on clinical hours requirements for many of our advanced practice roles. There is no evidence in the literature that clinical hour requirements serve as an effective proxy for core competencies, at least in the nurse practitioner role where this work has been examined. And while it seems that a competency framework for APRN practice is perceived by many nurses as desirable, our professional organizations really are individually moving in unique trajectories that are exclusive to each particular role. So, while we know that there are unique competencies for each of the 4 roles, this diagram poses a couple questions for a research agenda. Are there common or core competencies? Are they different from the competencies for other types of nursing practice? To what degree do they rely on each other? Are there existing or desirable milestones along a continuum over time? Can these be identified and measured? Can we think about an approach that divorces that artificial separation from education to practice, that looks at the development of competencies beginning from the time a student enters a graduate education program until following throughout the rest of their career. Finally, these are some of the ideas currently being considered by the APRN Clinical Training Task Force. They are proposed as only one potential method to advance an agenda of study. The first is to identify common core competencies across both role and population foci. Then to think about the identification of milestones for APRN core competencies, beginning in the preclinical era to graduation. And finally, developing a standardized assessment tool to be used by preceptors and faculty based on common core competencies. So in addition to learning from the experiences of our interprofessional colleagues, what are some possibilities to explore and refine our ability to identify and assess competencies in practice? Here are 4. What would essential competencies along multiple dimensions look like? Is there a possibility of the development of a robust yet efficient strategy for assessing those competencies? What's the relationship between competencies and patient outcomes, which is complicated, obviously, by methodological issues discussed earlier in light of the unit-based nature of nursing practice as it occurs in many settings? And what, if any, relationships exist between the achievement of competence and group or team interprofessional competence? It does sound like, from our discussions earlier today, many of us have thought about the nature of the relationship between individual professional competencies and where they may intersect with emerging interprofessional and team-based competencies. Thank you.